Hello everyone, you are welcome to my YouTube channel, Everything Medical. In today's video, we shall be discussing the scapula, which is the shoulder blade. So if you are coming across to my channel at the first time, don't forget to subscribe, like, comment, and also share our video so that your classmate or your classmate will also see it and benefit from it. Now let's proceed. Here on my hand is a structure called the scapula. So you can feel it, you can see it. Is known as the shoulder blade. It's one of the pectoral girdle, right? So the scapula and the clavicle are the pectoral girdle. So the scapula is one of the pectoral girdle. Now, if you see a bone, first of all, appreciate their physical look, their physical appearance, so that you know the features to look on. And here on my hand is the right scapula. You can see that is the right scapula because the glenoid cavity is directed forward. It's directed forward, upward on each direction. While the spinous process or the spine is directed posteriorly, right? And also, the coronoid process, which is this, is directed forward. So as you proceed, you get to know so much features about this scapula. So this is a right scapula. Then first thing to note is to give it a concept, right? Now, what is scapula? I'll be defining scapula based on three headings. Number one is large. Number two is flattened. Number three is triangular. So the scapula is a large, you can see it's large. It's a large, flattened, triangular bony structure that is situated on the posterior lateral aspect of the thorax. Now, why is it triangular? Because you can see the body is triangular. The body of the scapula is triangular. You can see it. It's triangular. That is why they conceptualize it as a triangular bony structure. And why is it flat? You can see that it's flat. So it belongs to one of the flat bones as a classification of bone, right? Because we have short bone, long bone, sesamoid bone. We also have irregular bones. So, but scapula is classified under flat bones, right? So, the vertical extent of the scapula, that is the vertical extent on the rib cages, because it has a vertical extent. It is from second to sixth rib, because the superior angle of the scapula, which is here, lies at the intercostal level of the second rib, while the inferior angle lies at the intercostal level of the seventh rib. That is why the vertical extent is from second rib on the superior angle to the seventh rib on the inferior angle. As you proceed, you get to see other angles, right? Now, that is the concept of the scapula. Let's go into the anatomical position of the scapula or side determination. That is another outline which I will be discussing. First of all, you can see that the glenoid cavity of the scapula is usually directed laterally. It's usually directed laterally. That is one of the anatomical side determination or the position of the scapula, because the glenoid cavity is usually directed laterally. Why the coracoid process, which is this, is usually directed also laterally. That is their anatomical side determination. However, it has other features, but these two features distinguish it on its anatomical position. Also with the spinous process, which is always posterior. It is found on the posterior surface or the dorsal surface. As you proceed, you get to know the surfaces. I'm just taking it bit by bit so that you understand this. So the number one side determination of the scapula is that the glenoid cavity is dilated laterally and forward, and also slightly upward. Also, the coronoid process is directed forward also, while the spinous process, which is a chef-like bony projection, which transverses the posterior surface or the dorsal surface, thereby dividing it into two fossa, the supraspinous fossa and the infraspinous fossa. You can see it is a two fossa. Supraspinous is superior, while infraspinous fossa is inferior, right? So as we proceed, you get to know more about them. So those are the anatomical side determination of the scapula, right? Now, the scapula is divided into four parts. We shall be discussing the scapula on those areas. The first part is the body. While the second, third part are the three processes. So here is the body of the scapula. You see from here, goes downward. Here as a whole is the body of the scapula. Right? Now it has three processes. One is the coracoid process, two is the acromion process, and three is the spinous process of the spine. Although some authorities affirm that it has three parts, which is the head, the neck, and also the body. But I'm going to be discussing it based on the four parts which I just mentioned. The body here, this is the body. This is all the body here, This triangular shaped area is the body of the scapula, right? Why this is the coracoid process, this is the acromion process, why this is the spinous process, which divide the posterior surface or the convex dorsal surface into two fossa, the supraspinous fossa and infraspinous fossa, right? So that is the four parts of the scapula. Now let's begin with the body, right? The body of the scapula is divided into three features. We have two surfaces. This surface I'm holding is called the costal surface or anterior surface. It is convex because it has a depression. That is why it's convex. I mean, it is concave, please, not convex. It has a depression. That is why it has a concave feature. You can see it is depressed, right? So this is the costal surface or the anterior surface, which is also a concave surface. It has the posterior surface or the dorsal surface or the convex surface. One of the distinguishing features between the posterior surface and the anterior surface of the scapula is that the posterior surface has a spinous process. So when you see it, you should not get confused, right? Because there is a distinguishing feature between the posterior surface and the anterior surface. First of all, the anterior surface is what? Is concave. It has a depression, right? While the posterior surface is what? Convex. It is arched, right? It is bulged. Also has the most distinguishing feature, which is the spine, the spinous process, right? So those are the two surfaces of the scapula. Now, let's go into deep on the surfaces. As you can see now that this is the anterior surface or the concave surface. The concave surface of the scapula usually have an oblique ridge. This is an oblique ridge. Right? These are ridges which provide sort of attachment for intramuscular tendons of subscapularis muscle. So the subscapularis muscle usually get attached here. It usually get attached here all through, right? Like this, on this manner. So these muscles here, all of them are called what? The subscapularis muscle. That is why this surface can also be called the subscapular surface. However, there is a fossa here called the subscapular fossa, in which the subscapularis muscle is attached by the virtue of those oblique ridge, in which it attaches with its intramuscular tendons, right? So that is all about this surface. I will discuss other muscular features when I get to the borders and also the angles, right? Now let's go into this surface. This surface is called the posterior surface of the scapula, the posterior surface of the convex surface. It is arched. You can see it, it is bulged, right? Now, I've told you earlier that one of the distinguishing feature of this surface is that it is what? It is being transversed by a spine, right? Now, watch. Look at this surface now, right? This is a spinous process. So, the posterior surface of the scapula is usually being transversed by a bony projection, a chef-like bony projection called the spinous process, which divides it into two fossa. The supraspinous fossa, which provides site of attachment of the supraspinatus muscle, and also the infraspinous fossa, which is the biggest one, which provides site of attachment of infraspinatus muscle. So that means the infraspinous fossa forms the upper one-third of the posterior surface, while the supraspinous fossa forms the upper one-third of the posterior surface, while the infraspinous fossa forms the lower two-third of the whole posterior surface. That is how to know it. So we have discussed the muscle attached here, the muscle attached here, right? And also this spine, right? We shall discuss this spine when I get to muscle, but let's discuss it. So you can see this spine now, right? This spine has upper and lower lip, right? So this is the upper lip, and this is the lower lip. The upper lip provides site of attachment of the trapezius muscle. Here, you can see it at this region, trapezius muscle. While the lower lip provides site of attachment of the deltoid muscle. The deltoid muscle went around this, how I'm marking it. It went around this region, like this, towards its lateral end also, this lateral end. So that is how it works. Two muscles attaches here, apart from the acromion process. So the lower lip provides site of attachment of the deltoid muscle, while the upper lip provides site of attachment of the trapezius muscle, right? Now, that is all about the surfaces. Recall that the reason why this anterior surface can be called the costal surface is because it faces the rib, and rib can be called costal. That is why it can be called the costal surface, right? So let's go into the next feature of the body, which is the triangles. Now watch. This is the the anterior surface, right? Or the costal surface, or the concave surface, right? Now, this is it has three angles: the superior angle, the inferior angle, and the lateral angle. The superior angle of the scapula is located at the level of the second intercostal space, or the second rib. I've said it previously when we started. While the inferior angle is located at the seventh costal rib, or the seventh intercostal rib. That is why the vertical extent of the scapula is from second to seventh rib. However, the lateral angle of the scapula is truncated to be called the glenoid cavity. You can see the glenoid cavity here. This is the glenoid cavity of the scapula here. So the lateral angle is usually truncated to form the glenoid cavity. Also, the lateral angle of the scapula is taken to form the head of the scapula. It's taken to form the head of the scapula. That means here is the head of the scapula, which usually gets communicated with the plate-like body of the scapula by an inconspicuous neck of the scapula. So that means the lateral angle of the scapula is truncated to form the glenoid cavity. Also, it is also being taken to form the head of the scapula, which gets communicated with the plate-like body of the scapula to form an inconspicuous neck or by an inconspicuous neck. So that is all about the lateral angle of the scapula. Now you can see that this is the superior angle. We have discussed it. I've also discussed the inferior angle. Now let's go into the next feature on the body, which is the borders. The scapula has what? It has 3 borders, right? It has 3 borders. So this is the medial border. This is the lateral border. This is the superior border. So the medial border on its costal surface, that is the anterior surface, give site of attachment of the serratus anterior muscle. So that means the muscle wind on this manner. It is usually on this manner. That is the serratus anterior muscle to the inferior angle. So the border extend, that is the medial border. The medial border extend from the superior angle to the inferior angle, while the serratus anterior muscle attaches extending from the inferior angle to the, superior angle to the inferior angle, right? So this lateral border, this is the lateral border of the scapula. The lateral border of the scapula is thicker, right? It is thicker because it serves as a fulcrum when the scapula is rotating. So that is why it's more thicker compared to other borders. This is the lateral border. It is thicker because it serves as a fulcrum when the scapula is rotating. Why the superior border here? The superior border is the shortest. You can see it's the shortest, right? So it extends between the lateral angle to the superior angle. And the superior border has what we call the sphenoglenoid notch or the suprascapular notch here. This is the suprascapular notch, right? Suprascapular notch, which provides the site of passage of suprascapular nerve, which usually wind on this manner, towards the infraglenoid tubercle. So the nerve usually crosses on this region to pass the suprascapular notch. And also, there is a ligament that converts it into a suprascapular fossa. And that ligament is called the transverse scapular ligament or the suprascapular ligament. It converts this suprascapular notch into a suprascapular fossa. The ligament is usually found on the both sides here, converting it into a fossa, which also gives site of passage of the suprascapular nerve. All these features are found on the superior border, on this region, right? So that is all about the superior border. Now, let's discuss the processes, right? So you can see we have already discussed the spinous process. Let's discuss the 2 remaining processes. This is acromion process. This is the coracoid process. This coracoid process is an important process because it resembles a bird-like appearance. It's like a bird beak appearance, right? It's like a bird beak appearance. It arises from the upper border of the head of the scapula. This is the head of the scapula. This is the head. So it arises from its upper border. Now you can see it now. It arises from its upper border where it bends sharply to project superior anteriorly. And as you can see, it is found majorly on the anterior surface, right? So it projects superior and anterior. That is why they say that it resembles a bird beak. You know the bird beak, the mouth of a bird, those ones that uses beak now. So, and it arises from the upper border of the head of the scapula, which is here, where it bends sharply to project superiorly and anterior. That is superior anteriorly. So that is how the coracoid processes. And also, this coracoid process gives site of attachment of muscles. First is on its medial margin here. The medial margin here, this region here, it provides the site of attachment of the pectoralis minor muscle here, while the tip provides site of origin of two muscles, the short head of the bicep brachii and also the coracobrachialis. So the short head of the bicep brachii and the coracobrachialis arises from the tip of the coracoid process of the scapula. That means they have common origin from this region. While here is the pectoralis minor muscle, right? Now, on this region, here is called the supraglenoid tubercle, which gives site of attachment of the long head of the bicep brachii, which is here. This region that is found on the upper part of the lateral border here, this is the infraglenoid tubercle, because this is the lateral border now, so it's found at the upper part of the lateral border. It provides site of attachment of the long head of the tricep brachii, the long head of the tricep brachii here, while here is the long head of the bicep brachii. Supraglenoid tubercle, infraglenoid tubercle. So that is how it works. Now, you can see the acromion process of the scapula, or the acromion. This acromion process of the scapula usually projects forward. It projects forward almost right angle from the lateral end of the scapula. And this is the lateral end of the scapula. This is the lateral end, right? So usually project forward, almost at the right angle from the lateral end of the scapula. And it usually gives site of attachment on its medial margin for the attachment of the oval facet on the lateral end of this clavicle, right, to form acromioclavicular joint. So that is how it works, right? So let's discuss the muscles on the lateral border and the medial border on the posterior surface or the convex surface. The first muscle is the teres minor muscle. The teres minor muscle usually have this here on this manner, and it's usually being interrupted by the circumflex scapular artery like this. So the circumflex scapular artery interrupts its origin. That is why it has to divide it into two parts. Here's the teres minor muscle. The next muscle, that means the teres minor muscle is attached on the posterior surface of the upper 1/3 on the lateral border of the scapula. You can see this is the posterior surface, right? And this is the upper 1/3 of this lateral border. So it gives site of attachment of the teres minor muscle. So the next one is the teres major muscle. The teres major muscle is here on this manner, right? So it's usually get attached on the lower 1/3 of the posterior surface of the scapula on its lateral border, right? You can see it's on the lateral border. Now, the next one is the latissimus dorsi muscle. The latissimus dorsi muscle here. It is usually get attached on the inferior angle of the dorsal surface or the posterior surface. You can see on the inferior angle, right, of the posterior surface or the dorsal surface, whichever one. The next muscle is the rhomboidus or rhomboid major. The rhomboid major usually get attached on the lower 2/3 of the posterior surface of the scapula on its medial border. Remember, these are on the posterior surface of the dorsal surface, right? So it usually extend from the origin of the root of the spinous process on this manner, please. On this manner, right? Usually extend on this manner. So all here are the rhomboidus major. While here like this manner is the rhomboidus minor, the rhomboidus minor muscle. So the rhomboidus minor muscle usually gets attached on the root of the spinous process on the posterior surface of the scapula. You can see this is the root of the spinous process on the posterior surface of the scapula, particularly on its upper 1/3. So here is the levator scapulae muscle, the levator scapulae, the levator scapulae muscle. The levator scapulae usually get attached here, usually on the uppermost 1/3 of the posterior surface of the scapula, right? So that is how the thing works. That is the scapula. So the next feature we shall be discussing is a muscle called the inferior belly of omohyoid. Usually get attached here. The inferior belly of omohyoid here on its superior border, right? So I believe you have done justice to the physical muscular regions of the scapula. Now let's quickly look at the ossification centers of the scapula. The scapula has 8 ossification center. It has 8 ossification centers, right? Number 1 is the primary and secondary ossification center. So it has 1 primary ossification center and 7 secondary ossification center, making it 8 ossification centers. The primary center usually appear on the body, while the secondary centers appears in different places. On the secondary center, which is the 7 centers, 2 centers appears in the coracoid process, 2 centers appears in the acromion process. You can see that this is the coracoid process. 2 centers here, 2 centers here, right? And also 1 center will appear on the medial border, another center will appear on the inferior angle, while another center will appear on the rim of the glenoid cavity, making it 7 secondary centers. Remember that I said previously that the primary center appears on the body, while the secondary center, which are 7, appears. 2 appears on the coracoid process, 2 appears on the acromion process, 1 appears on the rim of the glenoid cavity, 1 appears on the medial border, 1 appears on the inferior angle, right? So that is how it works. Now, the primary center of the scapula is found in the body, and also the first secondary center in the coracoid process appears in 8th week of intrauterine life. That means the primary center, which is the body, and the first secondary center, which appears on the coracoid process, usually found in the 8th week of intrauterine life and the 5th year of postnatal life, respectively. 2 of them fuses at the age of 15 years. That means the primary center and the first secondary center appears on 8th week of IUL and also fuses at 15 years, while all the rest of the secondary centers appears at puberty and fuses by 20th years, right? So that is how it works. I will repeat. All the secondary centers appears about puberty. It appears at about puberty and also fuses at 20th year. Why the primary center and first secondary center, which is the coracoid process, appears at 8th week of IUL and also the first year of postnatal life and fuses at 15 years. So those are the ossification centers of the scapula. Now let's quickly look at the clinical correlation, some of them. Now, on the clinical correlation of the scapula, first is the weakening of the scapula, which occurs as a result of the lesion or damage to nerve of Bell. right? Or nerve serratus anterior muscle, which is the muscle that went from the superior angle to the inferior angle found on the medial border. When the nerve that supplies to it got paralyzed, it will lead to weakening of the scapula. That means the medial border of the scapula will be protruded out on this manner, where it's situated on the posterolateral aspect of the thorax. It will protrude on this manner, right? A kind of a cushioning on this way. So it will cause weakening of the scapula. And also, when there is a traumatic injury to the thorax, maybe by an accident or a trauma, it could fracture the scapula, which will lead to a problem, right? So those are some of the clinical conditions that is associated with the scapula, right? I believe with this, you can get to understand scapula more better when you read it on your personal studies. Thank you so much for staying to the end. I really appreciate it.